Good afternoon and welcome to Healthy Lifestyle with Lorianne. I am Lorianne Casdia. Our goal here at Healthy Lifestyle is to inspire, educate, and empower you to fulfill a healthy, emotional, spiritual, and physical life. So today I wanted to talk to you about how you will help someone this week. Stay tuned to the end of the show. I really want you to think about that, how you're going to help someone else. We find ourselves sometimes diving too deep within ourselves and can't find our way out of our own darkness. And I always find that serving someone else is always the solution. When we're helping someone else, everything seems so much better and so much lighter. And that's why we're here. We're here to help someone else. And in that light, we have the great Sandeep Kapoor, MD. He is an assistant professor of medicine and emergency medicine at Donald and Barbara Zucker School of Medicine at Hofstra, and the director of the Screening Brief Intervention and Referral to Treatment Program. I think it's SBIRT at Northwell Health, and love having you here, Doc.
Thank you.
You are the epitome of the service that I'm talking about, because what you are providing, this program that you do at Northwell Health is really, it hits home for me, because I had a loved one who had an Oxycontin addiction, and I understand what families go through firsthand of trying to manage that and manage life. And you help people and have a lot of treatment programs going on. Let's talk about that.
Sure. Well, thank you once again for the kind invitation to be here, Lorianne. I don't know about the term great, but,
I think you are.
Well, I appreciate that.
Absolutely.
I appreciate that. And, if I could just echo what you said about finding a way to help others, I mean, that's really what drives us on a daily basis. As an industry representing healthcare and trying to take care of folks on a daily basis, that message may get lost, but at least through the work that the team that I have the privilege of being on right now, our main goal is really making sure our patients, their families, even our own employees aren't left alone when dealing with addiction issues or substance use issues.
Yeah, it's definitely one of those, you need the community to help, and we can't go down deep, because it's really hard to manage when you're doing it by yourself. And sometimes our exposure to healthcare is emergency rooms, and they're running in all directions and have a lot of pressure on them, and that's not really the treatment that you really would normally get. And I'm finding with Northwell, you have a lot of programs that you're putting into place to really help stay with the patient all the way through the process, not just get them in and out of the ER, right?
Yeah, well, so absolutely. And, I think we have to always pause and really look at the environment. There's competing priorities left and right. However, our number one priority has to be our patient and their family. So in the sense of talking about substance use and addiction issues, we've been trying universally throughout all of our hospitals. I mean, we have a pretty large geographical footprint within Long Island and the 5 boroughs in Westchester. We've really been trying to stand up protocols and policies and training so that we can support our own employees in the effort to support our patients and their families. Yeah. It starts off with, in my opinion, a very basic level, which is our foundation, which is the SBIRT program that you mentioned, the SBIRT, Screening Brief Intervention Referral to Treatment Program, where really what the manifestation of that is giving patients the opportunity, I think that's the key word, giving them a structured opportunity to talk to us about how substances may be playing a role in their life, and doing it in a medical setting under the scope of clinical team members, so that we can appreciate it as a healthcare issue, right, as healthcare employees as well as patients. It's very important for us to look at it as a healthcare issue as opposed to this socially driven issue that we've been looking at it for so many years. As
a stigma. We try to shame people that have these kind of addictions, and there's nothing to be shameful for. We're human. We have our flaws and faults, and I think the most heroic thing is for someone to acknowledge what shortcoming they may have, or an addiction they may have, and be able to take that courageous step to do something about it. I know I recently had some people that I was speaking with, and they were telling me about their journeys, and it's just heroic, because they make it's a choice. They make a decision to do something about it. And you're giving a safe platform for people to do that, right? As I understand it.
Yeah. And, and not just waiting for folks to come to that realization that they may need to make a change, but really, just like we would with high blood pressure. We wouldn't wait for someone to decide that they want to do something about high blood pressure. What we do is actually start the conversation. We take someone's blood pressure. We show them that they may be at risk for cardiovascular disease. And that's exactly what we're doing with Espert, is that we're taking a theoretical vital sign at that point in time to understand if substances are causing consequences in that patient's life, and then really laying out what options are available.
What their choices are, yeah.
Unfortunately, it's not something that's readily understood of what choices are available. I mean, we've grown up in a society where we look at this as something we hide under our dinner tables. We don't want to talk about it. And that has perpetuated the unknown, which is, what do I do if I want to make a change? Where do I start? And who's willing to partner with me to make that change? Yeah,
and I like that you're really tackling this question and giving options, because it's not just the person with the addiction. It's their entire family that goes through it in different ways, definitely in different ways. And one is no graver than the other. It's just very impactful across the way. And you're providing tools with various programs, correct?
Sure. So if we would look at this like building a house, our foundation is our Espert protocols and our processes. Our second layer of that, it really is our NALSAT program, which is naloxone saturation. Naloxone, folks may know as Narcan, the antidote for an opioid overdose. We're actually providing education at point of service to patients and their families on how to prevent fatal overdoses, including safe storage and safe disposal of medications, as well as how to use Narcan. Our third layer is actually starting treatment for addictions within the non-addiction treatment facilities. So, for example, in primary care or emergency medicine or inpatient care, actually giving the offering of medications that could help somebody with opioid use disorder or alcohol use disorder, at least initiating the treatment before handing off to the traditional addiction treatment folks. And then, another layer that we've added on top of this is looking at this in the frame of a chronic illness is truly care navigation and care management of the disease process. Right. I make this analogy that if you get a knee surgery anywhere in this country, you may get about 12 phone calls in the next 6 months. How you feeling? Did you pick up your prescriptions? You have 3 follow-up appointments. We do a very good job in ensuring that patient has someone by their side. Yeah. With that same lens, why can't we do the same for someone dealing with a substance use disorder or addiction? So we put together a protocol thanks to a collaboration between Northwell and a community-based organization called Central Nassau Guidance. And we really have been, over the past years, trying to demonstrate that care navigation, external care navigation. So the conversation starts in-house for us, but when someone leaves the 4 walls of our facilities, that conversation shouldn't stop. That advocacy, having a champion by your side, having someone to navigate the landscape of addiction treatment, it shouldn't stop there. And what we're seeing is engagement to care rates that are pretty much doubling or tripling national averages for folks actually seeking out and staying engaged in treatment.
Well, not everybody has the family member at home. They may be by themselves. So having that follow-up is very germane. And even with family around, it kind of reminds you, having that mom nagging at you kind of figure by having that phone call, and you feel cared about. So then maybe you take better care about yourself because somebody else is reaching out to care. Well, and asking those questions.
Absolutely. And, if you think about the power of engagement, right, especially around this kind of disease process where we don't usually have someone by our side that we can turn around and say, hey, I'm feeling vulnerable. Hey, I don't really enjoy what's going on. Yeah. But then having a measured approach where someone is outreaching to you as opposed to leaving the onus on you outreaching to them. Right. And then also when you do outreach, people don't turn their back on you, right? They're there to support you and your family. Yes. You mentioned family a few times. I think it would be very hard pressed to find anyone in this country that doesn't have a family member dealing with addiction. Yes. Knowing how that impacts family dynamics, the strain that puts, just like if someone was dealing with high risk diabetes or someone was dealing with cancer in their life. I mean, the shattering of families happens very quickly because it's hard financially. It's hard to navigate. It's hard to take time off from work to caretake for someone. Right. All these play a role in substance use disorder as well.
There's another level that goes goes in that, which is the loss of trust.
Yeah, absolutely.
Because there's a lot of things that happen that there's a loss of trust. So there's a lot of things to navigate without a doubt, from being the one who has the addiction to the family members. And it's hopeful for me to know that through the structure that you're putting into place, that perhaps some of the things that happened in my story won't happen again. Whereas we broke we got them dry off of the OxyContin, and then when they went into the hospital and they were in the shakes, the whole 9 yards, because the hospitals at the time didn't know how to handle it, and they went, nope, can't, you have to be off of it before we'll even touch you. We did that, went through that process at home, brought them in, and the doctor gave them another OxyContin. So we went and made them all dry, and when I asked the doctor why in the world would they do that, they said because the patient asked for it. I'm hopeful that, yes, the patient may ask for it, but because of the history and the signs, they saw all the signs, that maybe a different resolve would come to fruition as opposed to that. Yeah,
and to me, it comes down to transparency, and it has to come down to the willingness to really build partnership, right? So hearing the family's concern, hearing the patient's concern, understanding the clinical concern, and then coming up with a communal decision of what the best steps are.
How do you transgress the HIPAA issue? Because I know that that's something that I hear over and over again through myself, first personal experience, through other people, that, well, we can't listen to you because for HIPAA reasons, we can't, they're an adult, we can't talk to you about this. How do we get by that when it's not just them? We're actually, family members are part of our patients too at that point.
Absolutely. Yeah. Look, the vulnerability is a shared experience by far. Yeah. We really emphasize the respect for autonomy, right? So part of the motivation towards change is having those conversations of who else you want involved. And with a patient's permission, you can involve anybody. But it really comes down to understanding what barriers there may be for someone to involve a family member, and then having that trusting conversation to understand, is that really the right step for them? Right? So it's one thing to just blindly listen to what someone's saying and taking it for face value, right, and potentially putting them at more risk, right, for this addiction or for downstream consequences. It's another thing to build a partnership using the spirit of motivational interviewing to really understand where the patient is at and what they're willing to do. And even the smallest measures of change are big, impactful steps that could be taken.
Yeah. Well, talk to me about the motivational interview. That's very interesting to me.
Sure. So, the team members throughout the health system that are doing SBIRT have been trained in the spirit of motivational interviewing, which is really based on 4 pillars. It's partnership, acceptance, compassion, and evocation. These are 4 very easy words to say, but very hard to actually manifest as a skill. Probably folks find evocation the most difficult, which is pretty much sitting back and allowing someone to talk to you and being a good listener, as opposed to trying to share your agenda and trying to get someone to go from point A to point B.
Right.
Partnership is pretty simple to understand. Compassion is easy to understand. Acceptance is very difficult as well, especially with a chronic illness like this, where we've really have had blinders on our eyes for many years as an industry and even socially. Right. So using the spirit and using these communication skills that we teach, it's really about respecting patient autonomy, understanding where they're at, not forcing where we want them to go, but meeting them where they're at, and that facilitates change. And, it doesn't mean that someone needs to stop drinking or stop smoking or stop doing drugs the next day. That's maybe what we want. But even if they're willing to reduce their use, that's a great starting point and a great opportunity to build that trust, to build that rapport, to build that partnership, to do further changes downstream. So that's really the approach that we take, respecting patient autonomy, respecting the family's autonomy, understanding that if that patient does want the family involved, how to mitigate that, how to make that happen.
What if the patient doesn't want to? Because more times than not, the patient is like, I know everything, they don't understand, I don't want them involved. And they don't want that involvement, because with that comes responsibility, and they have to be able to accept what's going on and recognize what's going on to be able to accept and need and take that help, which at the point, if they think they're completely in control, they're not going to accept that help. What do you do there?
Great question, right? And very complicated question, because if you think about it, I think there's multi-layers there. I think guilt plays a big role into this as well, right? When you start sharing that burden, you know that you're putting a responsibility on your family. And at that point, maybe you may not trust your family. You think that you know all the right answers. Obviously, your judgment may be...
I was going to say, your judgment is impaired. So how can you make that determination?
So I think we have to put faith in the fact that to facilitate change, you need to welcome different perspectives. To facilitate change, you need to understand the value of, at least as a starting point, respecting where that person is at that moment. And I know it's hard because our knee-jerk reactions, especially in healthcare, and even I would just say, just by talking to you and knowing myself, we want to fix things pretty quickly.
Oh, yeah. I'm
right?
known as the fixer. I want to fix things.
Especially when we're in crisis mode.
Yes.
We want to fix things. But however, when we fix things too fast, without that person on board, that could be very problematic. It may be a short-term success as opposed to what we're looking for, which is long-term sustainability.
Absolutely. But to get them to that long-term sustainability, you got to get over that hump where they think everything, they're invincible.
Yes.
And I do see, and I've seen on a number of occasions, that change where they're like, oh, they don't need it. And they're also master at manipulation. So that being able to manipulate that medical staff who's trying to do the right thing and doing the motivational interviewing, they know how to answer the questions to make them think other than what's really going on. So they're masters at that. That's how they got this far in the addiction. How do you contend with that? Because I watched this happen too, and then all of a sudden the medical staff, through their own observation after a period of time, they were able to see what they were doing and they got it. But at that point, their hands were tied because they have a lot of, I appreciate the medical staff because they have a lot of things coming at them and their hands are tied in a lot of cases. And I'm hoping that your program, Northwell, is seeing that that's not necessarily the best thing to do. Yeah.
So, great point. I mean, you mentioned the word manipulation, and look, I think all of us, whenever it suits us, we can manipulate a situation, and it's not just around this chronic illness. I mean, there's other illnesses out there where folks manipulate their care for, to whatever suits them best. I will say, and I just want to reaffirm this, yes, healthcare professionals have a lot going on, you know, especially in certain environments more than others. And, for us to build a movement around at least the 70,000 employees that we represent in New York State, a movement of looking at this in a compassionate way, reframing the conversation from that socially kind of driven issue, really bringing it home to what we understand, which is a medical issue, a healthcare issue.
Sure.
I do think we're taking the right steps forward to better appreciate when someone comes in, a family member's in crisis, how do we really handle it as opposed to the old days of this industry where we kind of, unfortunately, didn't do a good enough job as an industry. We would turn our back and really let people fend for themselves. And we would, dehumanize it very quickly.
Yep. It was this is your problem, not our problem. We don't handle this. And I'm not seeing that anymore. And I really appreciate this program that you're putting into place. And you're opening a facility out in Calverton, correct?
That's correct. So, it'll be a freestanding addiction treatment center. It's called Wellbridge. It will be out in Calverton, New York. I believe the doors open in October of this year. And really state of the art. We're talking about research. We're talking about top-notch clinical care. And one of the things that I really appreciate the most about this is because we have such a large health system as Northwell represents, the lessons that we learn at Calverton are going to be not only shared with all of our addiction treatment facilities in Northwell and throughout the state, but also some of the studies will take part in the existing Northwell facilities as well as around the state from other healthcare organizations. So, instead of the old fail-safe that you need to send family out of town to get high level of care and then unfortunately family come back without a care plan,
right?
This to me really satiates that demand, which is why do we need folks to leave our local area to get that level of treatment? And then even when they're getting reinserted back into the community, we have this sort of footprint, both digitally as well as physically, to support them.
Yeah.
So we're very excited about Wellbridge. To us, it's another layer on top of this house that we're building, which provides another level of care that unfortunately unfortunately just currently doesn't exist locally right now for us.
I love the fact that you're going in that direction and what you're putting behind it. This is going to be so helpful, and I would love to bring the Healthy Lifestyle crew out to your new facility when you're ready to open the doors and walk through and do a virtual verbal walkthrough of the facility and just interview a bunch of different people that work for you.
Absolutely. We're planning to make sure that it's an educational hub as well.
Yeah.
So we're going to hold symposiums out there, bring healthcare professionals from all around the area. So not only can they see the facility, but also we could talk openly about best practices and really what the direction of addiction treatment is going.
Yeah. And I love, I believe in collaboration. I think it's best. Multiple minds are always better than singular minds. So that's a really good thing. Oh my gosh. I have so many questions for you, so many things to cover. You need to come back because we really need to continue this conversation. I think it's important to get the information out there, and I really appreciate you so much. I can't even tell you.
The appreciation is shared. We're in this together, and I really thank you for the opportunity.
No worries. You're listening to Healthy Lifestyle. I'm Lorianne Casdia, and we will come right back. Thanks again, Doc.
Absolutely. Thank you for having me.
Welcome back to Healthy Lifestyle. I'm Lorianne. If you have any questions, comments, or ideas on topics, guests, or anything you'd like to talk about, we'd love to hear more from you. Just email us at healthylifestylewithla@gmail.com. That's healthylifestylewithla@gmail.com. And of course, follow us on social media, Healthy Lifestyle with LA. So to round out this particular show on this beautiful Saturday, we have Dr. Sanjey Gupta. He is with Southside Hospital. He's an associate professor of emergency medicine at the Donald and Barbara Zucker School of Medicine at Hofstra, Northwell, and a voting member of the board of directors for New York chapter of American College of Emergency Physicians. He is the Southside Hospital new emergency medical chair. Welcome, Doc.
Oh, thank you very much.
Thank you so much for coming on. So let's talk about emergency services, because I don't know anybody who hasn't been to an ER at least once in their lifetime. So what kind of new things are you doing at your emergency services over in Southside?
Oh, it's a very exciting time for Southside Hospital and for the emergency department at Southside. Basically over the past 2 years, we have really transformed the department. It's a brand new constructed department, 55,000 square feet.
Wow.
And what we have added in that time are several things. We have transitioned the department into a teaching department, which is very exciting. So starting July 1, we actually have our inaugural class of an emergency medicine residency. And what that means is we'll be training medical school graduates who want to be emergency physicians. So it'll be a 3-year residency training program affiliated with the Zucker School of Medicine. And we're very excited to have this starting. That
is, it's fast and furious in an emergency room. Who chooses to do that? Why is this something that you're passionate about?
That's a good question. And I think back to now it's been about 20 years for me of doing this. But what prompted me to go into emergency medicine? It's sometimes that. Sometimes it is taking care of everybody and everything at people's most vulnerable times.
Yeah.
And one thing that's very unique to the emergency department versus other medical specialties is that we are open 24 hours a day, and we see everyone that walks through the door. So that ability to provide that service to people in their time of need was something that was always very attractive.
And that's why you went into medicine, right? Because you wanted to do right by the patient.
Absolutely. And emergency medicine affords myself and everyone else who does this specialty the opportunity to provide that service for anybody at any time.
Yeah. So, and that's not an easy thing to do because it's a carry on through. How do you carry it on through after you provided them the emergency services that you have to do? And then now we're going into the next step. So like we were talking about with Doc in the last half, we were talking about, you get knee surgery and then for 6 months you have PT and you get phone calls and follow-up phone calls. And how do you do that with your emergency services?
Yeah, that's a good question. So one thing about emergency medicine is that one of the downsides of the field that was always presented as a physician was, you're never going to see patients again. You're going to see them one time.
Yeah.
And you're not going to have that follow-up like in PT and this or that. But it's really not true because we provide a service to the community that our department is is located in. So I often, believe it or not, see the same patients again because they like the service so much that they come back for their emergency care.
Really?
Yes.
That's great. That's great to know. Yeah, because I've seen emergency. I used to have bad colitis attacks, and I would see the doctor in the emergency room, and then go back to my practicing doctor, and I would never see the same doctor twice in the same hospital.
Yeah, it's very interesting now is that patients know that if they have an emergency, they know the emergency department is the place to go. And what's been really beneficial, a lot of physicians will not like this current statement, is we've transitioned from paper charts to computer charts, which are electronic health records, which are really onerous to use in terms of typing and in some respects slows down, but provides us a treasure trove of information on patients. So you well know that even if I haven't seen you before in the emergency department, I have information on you if you've been there before.
Yeah, they definitely had information. They would go back to it because they had those rolling cart things with all the information on it. So that was helpful for the doctors, no doubt. So that's good because that's really good for continuing care. Now, especially this time because of summer, it's hot out there, bug bites, sunburn prevention. What do you recommend with that?
Oh yeah, that's a good question. I think one of the really special things about living on Long Island is the ability to enjoy the outdoors and enjoy the sun and the beach. And, I think we all know that some of this comes with, we should always be a little safe. So first things first, the beach is wonderful. Make sure you get that sunblock on. Yeah. And reapply after you go in. You go in, you enjoy the water, you come back out, make sure you reapply. You want to have a minimum of SPF 30 on to prevent skin damage. And look, if you've lived on Long Island your whole life and you've gone to the beach and you've had a few sunburns, fully recommend that you make an appointment with a dermatologist fairly regularly just to have that skin checked out to make sure that no problems. That's a very good recommendation. What about heat exhaustion, heat stroke? We see a lot of our seniors kind of getting heat stroke. It's been really hot, and not this season so much, but in the past seasons where I kind of felt like some of us of younger ages were getting kind of heat. It felt like maybe going towards a heat stroke. Yeah, it kind of creeps up on you. And I find that this is the time of year where we're seeing more and more patients in the emergency department for heat illness. We call that. It's kind of the catch-all for different things. So what are the symptoms that someone should look for? I mean, obviously we need to hydrate, and that's something I like run around the beach and go, hydrate. Right, and hydration is key. Our main mechanism for cooling our body is by sweating, and when we sweat we lose water, so we want to replace that. Right. And but one thing that I always mention is the caveat is water is great, but make sure that you get some electrolytes in too, and that's something people forget. So on the spectrum of heat illness is something called heat cramps. So you might see this: you're out running, it's hot out, and your body starts cramping, or you're out working in the yard, you're working on the roof. We see this with a lot of people actually work outside. Because they're drinking, they're doing the right thing that's recommended, but they don't get salt in or other electrolytes, so their muscles start cramping. So often they get better with just going in the shade and drinking some drinks with electrolytes. That might be like a Gatorade type drink or a different electrolyte solution. Are there different ones? Because I can't do Gatorade. Yeah. For being a salt addict, it's really weird. I don't like Gatorade. Yeah, that certainly there are. I mean, and you can trial these. There are a lot. There's some tablets that you can just kind of add to the dissolve water. And then you can see whatever works for you. Believe it or not, there are a lot of endurance athletes who are out there running in this heat or doing exercise, and they actually take salt tablets. So, really? So there are a lot of different options out there. So I would definitely talk to your doctor before doing that, because I don't know what the blood pressure thing is to the salt tablets, right? Absolutely, that's a good point. And there's that's heat cramps. There's just kind of heat illness. You're outside, you're working, you're not really quite acclimated. Your sweating's not quite right, and you're just doing too much. You might feel dizzy, you might feel tired. You have the cramps. Getting yourself into the shade, get cool. Make sure you drink some electrolytes, and usually you'll improve. And you can get nauseated too, right? Absolutely. Yeah, nausea and vomiting. The thing that we get concerned about is heat stroke, and that's where you have basically outstripped all these mechanisms to cool your body, and your body temperature is really high. You may be sweating, you may not be sweating, but your temperature being high, we're talking about Fahrenheit-wise, 106, 107, 108 degrees. And it really starts affecting your proteins, your organs, your brain, and actually, I mean, unfortunately, can lead to death in some situations or permanent neurological injuries.
Okay, so we're going to hydrate this summer. How's that?
Yeah.
That's good. What about drowning? Do you get a lot of incidents of children, adults drowning? It doesn't take a lot to drown, does it?
Yeah, no. Drowning, unfortunately, is we start seeing this time of year once pools open because, in our region and in many regions, it's mainly going to be drowning in your backyard pool or in other natural bodies of water. So when you look at some of the CDC information, any given day in the United States, on average, you have 10 people dying of drowning.
Oh, my goodness.
Yeah, but unfortunately, about 1/5 of those are people under the age of 14.
Yeah.
So our very vulnerable population in our area are going to be kids under 5 years old.
Falling into pools or
getting
in. I know my mom, when I was little, dragged me out of a pool upside down by one leg. She reached in and grabbed me and pulled me out by a leg. I'll never forget that.
Yeah,
so.
And that's great that she was being so hyper vigilant.
Yes.
Yeah, there have been some news stories even recently about, and I don't know how much validity there is, but just are people on their smartphones or smart devices so much that they're not paying attention to kids at the pool these days.
Yes, that's a really good point. So I want you to repeat that about paying attention when you're around the pool with especially the little ones.
Yeah, I would just say if you're around the pool with little ones who don't know how to swim and they can't self-manage, make sure you're not on your devices and you're paying attention because drowning, unlike what we've seen on television and in the movies about people thrashing around and screaming, doesn't happen that way. It happens very quietly
and quickly
and very quickly.
Yeah, and we don't want to go through the summer and have something like that happen. So please stay off of those devices while you're around the pools, and if you can, have somebody being observant. If you need to be on your device or you need to leave the pool side and you have children around there, make sure you leave an adult in charge who can swim and who's watching the children. So that's why we have lifeguards, right?
Absolutely.
I was recently, just 2 weekends ago, away at Long Beach, and they had the lifeguards, and they're like every so many feet. It just seems like there were a gazillion of them, which was great. But they had this area that they would watch in, and if you weren't between the flags, they would literally run down to the people and say, "Could you just move over 1 foot and be in between the flags for us?" And I thought that was great because they were really keeping it within an attainable, manageable area for themselves and keeping the people safe. So I thought that was really fabulous. So please pay attention to the flags on the beaches and pay attention where those lifeguards are. You want to be as close in the proximity of them. 1, they'll be able to see you, and 2, they'll be able to get you quickly if necessary. So I also noticed when they came out to talk to the people, because I don't put my feet in the water until like September. I'm just terrible like that. I don't like cold water. But I was intrigued that he brought his equipment with him, because he wouldn't have had time if something happened to run all the way back and then to run back, run all the way back, get his equipment and run back to the person who was in trouble. So he had his equipment with him. So I thought that was a really nice procedure that they have in place over in Long Beach, and I believe they have the same procedure on Jones Beach. So I don't know any other beaches other than that have lifeguards on it. So
yeah, absolutely, and that's a good point, because if someone is in trouble and if a drowning has occurred, the real care and the what we call resuscitation in medicine is respiratory. So you want to get that person on oxygen or breathing or assisted respirations as soon as possible.
Yeah. So it's all good stuff. What other things do you see this time of year that's pretty, common, things that people can avoid so we can reduce the amount of people coming into the ER and allow you to do other things like training with your staff, because they're going to be so bored?
Yeah, absolutely. Look, people are out and about. People are out having a good time. You're seeing many more bicycle injuries, for one. People are out riding their bikes.
Yeah.
So always remember, one of the things that really, I don't want to use the term irks, but, I always find curious is, I love it. I see children wearing helmets. Their parents have helmets on them, but the parents are out riding their bikes and the parents don't have helmets on.
Yeah.
So the bike helmet is one of the true tools that we have to prevent injuries out there when it comes to helmets. It's been tried and tested, so I just encourage everyone, if you're out enjoying your bicycle, wear a helmet. I do every time.
That's good. Yeah, absolutely. Anytime you're on any kind of bicycle or motorcycle, gotta have the helmet on. Gotta use the equipment. And if I see one more motorcyclist with sneakers on and not a proper foot attire, I may pull them over, because that is so unsafe. They can break an ankle and or their leg depending on the impact, and it takes seconds. It takes just a slight tilt of that motorcycle to hit your foot the wrong way if you don't have the right footwear on. So there's a reason why we wear boots, and it really does give us a lot of protection. So I'm not a proponent of that. When I see that, I just squirm. I know it's hot, but you got to do it.
Absolutely. I mean, the recommended clothing for motorcycle riders is to prevent many things. Just that road rash, is if you have to put the bike down and you're sliding on the ground, just, the difference between wearing boots or, a canvas sneaker is huge. I mean, you're talking about saving your skin, saving your flesh, a lot of things. So.
Yeah. Oh, thanks for that visual. That was really good. Yikes. But and bicycles, they ride with the traffic, not against the traffic. When I was younger, I shouldn't say we, I think I'm older than you are. When I was younger, we were told to drive against the traffic on our bicycles, and that is not the case anymore. We're supposed to ride with the traffic, and we don't have the right of way as much as people think that we do. Bicycles do not have the right of way.
No, bicycle. We're supposed to follow the traffic.
Yes.
Yeah. Other things, people are outside. Insect bites are a big thing. Ticks. We are definitely in a Lyme endemic area.
Yes.
On Long Island. So
all those deer.
Yeah. So keep that in mind. That if you're outside, if you're enjoying one of the state parks, if you're hiking, just have tall socks on. Try to wear long pants. You want to prevent the tick bite. The deer tick, which is responsible for Lyme disease, is really, really small.
Yeah.
Size of a pinhead. So you may not even see it for days on you. And, just to protect against that, obviously some sort of insect repellent, because we have mosquitoes out there, and, mosquitoes are annoying. We can have big welts or, reactions on our skin, but even some other things, mosquitoes can carry other diseases like encephalitis. So to be safe, use some insecticide.
Yeah. So, and try to use the healthy one. I'm not a proponent of DEET. So try to find something that you're comfortable with, and make sure your children have it on as well. But don't forget yourself. I know in a lot of cases I'll take care of my kids and I'll forget to put it on myself. Sunscreen, insect spray and repellent. Sometimes I forget to do that. So don't forget to take care of yourself. It's almost like the oxygen mask in an airplane. Put it on you first and then help everybody else. So we need to do that. If you were to give one piece of advice that absolutely was necessary and you would want everybody to know about emergency services that you provide and what could help them, what would that be, Doc?
I think the important thing to always have, if you have any kind of chronic diseases that you're taking medications for, always have a list of your medications and the doses, and just a list of the illnesses you have. And because sometimes it helps a lot, particularly if you're in distress when you're in there. You're upset, you're in pain, and you can't quite bring these things to mind. If you keep a little list on your phone, that's really great. And or in your wallet if you're old school, or in your purse, that's always very helpful to any medical provider, whether that's a physician or a nurse practitioner or a PA or a nurse in the department, to know how that we can help you the best. And
allergies, right? You should keep a list of your allergies too.
Good point. Yeah. Absolutely. And I also advocate that we never maybe I think about the worst a little too much being an emergency physician, but most people have a smartphone these days.
Yeah, sure.
It seems you may want to have a setting on your phone called "In Case of Emergency." That if you're in the emergency department and you can't speak, but on your contacts you have "In Case of Emergency," we know who to call.
I don't know if this is on Androids, and I don't know if it's on other smartphones, but on iPhones, there's actually in the iPhone, it comes with every iPhone, a healthcare. Look it up. Put your information in there. I have my prescriptions in there. I have my allergies in there. Just for that purposes, is the hospital can get into it, or someone can get into it without your password, to be able to find out what that information is if you have an emergency situation. So
Absolutely.
I think that's really important. The thing I love about that is they can get to that regardless of a password. So I think that's an important element. So really smart advice, Doc. would be very helpful for people to have. Plus, I know, in going to emergencies with my kids and stuff like that, I don't remember all their stuff. And, like you said, when you're in distress, you may forget to tell something to the doctors. So it's up to us to be our own advocates. We are our best advocates, and they'll do a better job helping us if we provide them with all the good information, right?
That's exactly right.
So any other advice before in our last couple of minutes?
I think always being open, as healthcare providers, we're people, as physicians, we're people, but we're here to help you. So never limit information. So tell us everything that is going on. Don't be embarrassed. Don't try to intellectualize it. Just let us know. Let us work with you to try to come up with the best solution.
It's a judgment-free area, right? You're just trying to get the information to help the patient, right?
Exactly right.
Yeah, so it's a good thing. So I love why you got into the medicine, so you could treat people and treat them better. And I see that you're doing that with your emergency services departments. You're really having that aftercare touch and that personal one-on-one touch. We're not numbers anymore, and I really appreciate that's the direction you're leading Northwell. And you should be very proud of yourself, and I'm honored to have you on the show.
Oh, thank you very much.
So thank you so much. I hope you can come back. We can talk more about some other things you're doing with the program. And in the meantime, I hope everyone here has a really good Saturday. Remember, do a little something for yourself every day. It starts there. It doesn't have to be big, but definitely take a moment for yourself and do something for yourself every day. Create a habit. Remember, at the beginning of the show, we talked about how will you help someone this week. Think about a person in your life who may be struggling in some way. It doesn't have to be a large way. And maybe one of your friends is finding hard to get over a broken relationship, or family member is struggling to adopt a healthier lifestyle. Maybe a coworker is having a difficult time with dealing with an issue at work. So just ask yourself, what is one small action you can take to help that person? It doesn't take a lot of time. It doesn't have to take money. It just a little bit of something to help them. Maybe just a smile. It starts with a smile sometimes. So think about that. I hope you have a really good week. Thank you as always for joining us on Healthy Lifestyle. I'm Lori Casdia, and until next time, show up for you and show up big.